Frau Schmidt, beschreiben Sie noch mal, wo Sie den Hauptschmerz spüren.
The doctor asks the patient to describe the painful spots, which may even cause referred pain in the knee.
Und dann auch hier im Gesäß und zieht runter bis ins Bein.
Before treatment is started with the Duolith SD1, the painful spots are localized by palpation following the patient's indication of pain. Afterwards, coupling gel is applied to the skin. Treatment is started at the point of maximum pain using the patented radial de-actor technology. The deeper sighted the pain region, the higher the application energy can be selected, and the more firmly the de-actor can be pressed on the application area.
Bitte den Arm nach vorne anheben.
Chronic shoulder pain is the most well-known indication for orthopedic shockwave therapy.
Nochmal zur Seite, bitte.
This condition typically causes referred pain, which manifests itself by a substantially reduced mobility of the shoulder-arm region.
Wir suchen jetzt den Schmerzpunkt. Bitte sagen.
Flat palpation and movement of the medial deltoid muscle ensures precise localization of the painful spot.
Wie ist das?
Ja, das.
In our case, the point of maximum pain is located at the tendon insertion below the bursa.
Genau.
Herr Berger, die für Sie schmerzhafte Stelle ist.
A model is used to show the patient where the pain mainly originates, in this case at the tendon insertion below the bursa.
Den habe ich hier oben durch Druck auslösen können. Hier vorne ist das Schlüsselbein und da das Schulter-Eckgelenk. So, ich zeichne jetzt den.
The doctor marks the affected deltoid muscle and the trigger points to give the patient a better idea of the pain region. After the painful spots have been localized, a preliminary ultrasound examination is performed to identify the pain region to be treated. A needle is used to provide a better contrast to the reflections from bone structures. The tense and hardened pain regions are treated by applying radial pressure waves over a large surface area. Muscles relax and lengthen and the affected tissue softens. Trigger points are eliminated, in other words, inactivated. Deep-sighted target areas can be reliably reached with the high-energy focused shockwaves generated by the Duolith. The penetration depths achievable with these standard delay lines provide variable focal areas of 30 and 45 millimeters.
Bitte mal auf den Handrücken setzen. Komm, richtig schön anbeugen. So, wunderbar. Und damit haben wir diese Stelle.
The doctor marks the painful region and places the applicator in position. The patient is treated with 1000 pulses. If specific spots rather than larger areas need to be treated, an optional articulated arm can be used to fix the applicator. Shockwave systems developed by Storz Medical are synonymous of therapeutic individuality and offer ultimate versatility in orthopedic pain therapy. Patellar tendonitis is a frequent form of insertional tendonitis, especially among amateur sports people. The painful spots are localized by flat palpation and by pressing the patella upwards. Owing to its unparalleled versatility, the Duolith SD1 also opens up new possibilities for diagnostic applications. Precise localization of the painful spots is ensured by using focused shockwaves.
Ich bleibe hier oben mit der Hand liegen und setze jetzt bei 6 Uhr an.
Application is started at the lowest energy level. The selected delay line determines the therapeutic penetration depth. The energy level is then adjusted to the recommended setting so that the diagnostic use of focused shockwaves can be followed by the actual therapy without any interruption. The chronic form of patellar tendinitis is often characterized by the presence of trigger points on the single or double joint adductors. This always involves the pectineal muscle. Trigger points are hyper-irritable spots in tissues. They are painful when compressed. This is a quote from Simons and Travell. Radial pressure waves supplied by the Duolith are applied to the affected tissue over a large surface area to ensure maximum targeting precision. In the treatment of the tibial stress syndrome, focused shockwaves are used to diagnose the pain regions along the tibia.
Hier an der Stelle?
Ja.
Gut. Und das können wir jetzt durchbehandeln.
Treatment is then performed by applying radial pressure waves laterally along the inside border of the tibia.
Möglichst mit diesem Gerät nicht an die Schienbeinkante kommen, das tut weh.
Adjacent muscles must be stretched during pressure wave application. In the case of achillodynia, the painful spots along the Achilles tendon are localized on the basis of the patient's indications of pain. The focused shockwave applicator is placed vertically on the tendon, and an initial shockwave energy level of 0.1 to 0.2 millijoules per millimeter is selected. The peripheral trigger points are then treated with radial pressure waves using 2000 pulses as recommended.